Dan Patrick, the lieutenant governor, is that wise man who said a couple of months ago that he would rather die or death is better than being in a lockdown, the kind of lockdown that you're describing. Explain to us how the lieutenant governor in Texas leverages so much power over the actions of the governor.
You know, it's a really interesting vestige of the way that Texas's government formed after the Civil War, where power is decentralized. The governor is relatively weak compared to governors of other states, and therefore the lieutenant governor, who presides over the state Senate, some would argue holds the most power in the state. And given how far Dan Patrick is to the right of Abbott, and how, given the fact that we last elected a Democrat statewide in 1994, every statewide Republican office holder is always looking over their right shoulder to watch out for that attack from the right. And that's why Dan Patrick and this death cult that he's trying to lead here in Texas, where he says there are more important things than living, as an argument to reopen the state. And Lawrence, as you know, the minimum wage here is $7.25 an hour. The people who are dying, by and large, are Latinos and Black Texans. When he says there are more important things than living, he's asking minimum wage workers, Black Texans, Latino Texans, to do the dying. The Rio Grande Valley and South Texas getting hit so hard by COVID-19. Those are 90% plus Mexican-American communities. He just literally does not care about them. And he does have a very powerful voice in the Republican-controlled state government right now.
What about the voice of the medical community in Texas? Because Texas is one of the great medical centers of the United States, between Houston and Dallas, and but from medical schools to just really just top end in every single way. Do those physicians and the people in the medical community have no voice in the way this is happening in Texas?
Individually, they do. My sister, Charlotte, is an ER nurse here in El Paso, so she's got a voice that I certainly listen to. I mentioned Dr. Peter Hotez out of Houston, Texas, and Texas Medical Center. But I want you to listen to this. Daily, the Texas Medical Center was reporting their ICU bed capacity, and it was at 96%, then at 97%. And then they get a call from Governor Abbott saying, I don't like the headlines that you're running out of hospital beds, so stop publishing the information. And you know what? They do. So he was able to force an end to the transparency, the public health reporting, and the information that all of us can use to make real world decisions like wearing masks and staying at home and understanding just how bad this crisis is. So individually, those nurses and doctors and the frontline staff, including the custodians, are my all-time heroes because they're literally risking their lives to save the lives of others. But I am disappointed in some of these hospital CEOs who are not speaking truth to power and sharing the truth with the rest of us here in Texas.